I want you to do something for me right now. Hold up your hands in front of you. Look at them carefully. Your palms, your fingers, your knuckles, the skin between your joints. Now I want to ask you something that most doctors never ask their patients until it is already too late. What if everything you needed to know about your kidney health right now, today, was already written right there in your hands? What if your body has been sending you signals for months, maybe even years, and nobody ever taught you how to read them? My name is Dr. Michael Ellis. I am 87 years old, and I have been a practicing nephrologist, that is, a kidney specialist, for over 55 years. I have sat across from thousands of patients in my clinic, and I can tell you with complete honesty that the conversation I dread most is the one where I have to look someone in the eye and say, if we had caught this 6 months earlier, we could have done so much more. That conversation happens far too often, because kidney disease is what we in medicine call a silent killer. By the time most people feel sick, truly sick, up to 90% of kidney function can already be gone. There are no dramatic warning bells, no sharp pain that sends you rushing to the emergency room. Just quiet, gradual damage happening deep inside your body while you go about your daily life. But here is what I have learned after more than 5 decades of treating kidney patients. The kidneys are silent, but the body is not. And one of the places your body speaks the loudest, one of the places it leaves the clearest clues, is right there in your hands. Today I am going to walk you through 8 specific warning signs that can appear in your hands when your kidneys are under serious stress. Some of these you may have already noticed and dismissed. Some you may be seeing for the first time. But every single one of them deserves your full attention. Stay with me until sign number 7. In 55 years of practice, that is the one I see dismissed most often, and it is the one that breaks my heart every time because it is so easy to catch early. Let us begin. Before we get into the 8 signs, I need to give you 90 seconds of context, because understanding why your hands reveal kidney problems will help you take these signs seriously. Your kidneys are 2 fist-sized organs sitting just below your rib cage in your lower back. Every single minute of every single day, they filter about half a cup of blood. Over the course of 24 hours, your kidneys filter roughly 200 liters of blood, removing waste, balancing minerals, controlling fluid levels, and regulating blood pressure. Think of them like the most sophisticated water filtration system ever built. Now imagine that filtration system slowly getting clogged. The waste that was supposed to leave your body starts backing up. The fluid that was supposed to be regulated starts pooling in places it should not be. The minerals that were supposed to stay balanced start going haywire. And where does all of that show up first? In the extremities, in the places furthest from your heart, in your feet, and in your hands. Here is the other critical piece of context. After the age of 60, your kidneys naturally lose about 1% of their filtering ability every year. That is completely normal. But when you add high blood pressure, diabetes, chronic dehydration, certain medications, or inflammation, that decline accelerates dramatically. In my 55 years of practice, I have seen this pattern repeat itself thousands of times. And I can tell you, the patients who caught it early were always the ones who paid attention to the small signs. The National Kidney Foundation estimates that 1 in 3 American adults is currently at risk for kidney disease, and the majority of them have no idea. You are watching this video today. That already puts you ahead. Now let us make sure you know exactly what to look for. Sign number 1. Persistent puffiness or swelling in the fingers. Let me start with the sign that is most visible and most commonly explained away. Have you noticed that your rings feel tighter than they used to? Not just in the morning, but throughout the day? Or that your fingers look slightly puffy, almost like little sausages, even when you have not been doing anything strenuous? Most people blame this on heat, or salt, or just getting older. And sometimes they are right. But when kidney function begins to decline, one of the first things that breaks down is the kidney's ability to regulate sodium and fluid balance in the body. When the kidneys cannot properly filter excess fluid, that fluid has to go somewhere, and it goes into the soft tissues, including the tissues in your fingers and hands. This is called peripheral edema, and in the hands, it shows up as that tight, puffy, slightly shiny appearance in the fingers. Here is the key difference between normal swelling and kidney-related swelling. Normal swelling from heat or salt tends to come and go within hours. Kidney-related swelling tends to be persistent. It is there when you wake up. It is still there at noon. It may fluctuate slightly, but it never fully resolves on its own. The medical term for this is pitting edema. You can do a simple test right now. Press your finger firmly into the back of your hand or into a swollen finger for about 5 seconds. Then release. If the indentation stays, if the skin does not immediately spring back, that is pitting edema. And that is something that warrants a conversation with your doctor. In my decades of practice, I have seen patients walk in with rings they could not remove for months. And when we ran their kidney panel, the numbers told a very clear story. A 2021 study published in the American Journal of Kidney Diseases found that persistent hand and finger swelling was present in over 67% of patients who were later diagnosed with stage 3 chronic kidney disease. And in the majority of cases, the swelling had been present for more than 8 months before the diagnosis was made. 8 months. Think about that. If you are seeing persistent puffiness in your fingers, do not dismiss it. Write it down, note when it started, and bring it to your doctor. Sign number 2, pale, yellowish, or dull skin on the hands. Now look at the skin on the back of your hands. What color is it? I do not mean your natural skin tone. I mean, does the skin look healthy and vibrant? Or does it look dull, washed out, slightly yellowish, or almost grayish compared to how it used to look? This is a sign that many people notice, but very few connect to their kidneys. Here is what is happening inside the body when this occurs. Healthy kidneys produce a hormone called erythropoietin, EPO for short. This hormone signals your bone marrow to produce red blood cells. Red blood cells carry oxygen to every tissue in your body, including your skin. When kidney function declines, EPO production drops. Fewer red blood cells are made. Less oxygen reaches the skin. And the result is a condition called renal anemia, which can show up as pale, dull, yellowish, or grayish skin, especially on the hands and face. When kidneys struggle to filter waste, yellow pigments and toxins can build up in the body. Over time, the skin may lose its normal color and begin to look washed out, ashy, or faintly yellow. Now, I want to be clear. Pale skin alone does not mean kidney failure. Many things can cause it. But if your hands look dull or yellowish, and you are also noticing swelling, itching, weakness, or any of the signs I am about to explain, that combination matters. Look at your hands and compare them to an old photo from 2 or 3 years ago. Has the color changed? Has the brightness faded? If yes, keep paying attention. Sign number 3. Extreme dryness, cracking, or itching of the hands. This is one of the most ignored signs. Many people say, "My hands are just dry, I need more lotion." Sometimes that is true, but kidney-related itching is different. When kidneys cannot remove waste properly, toxins such as urea can build up in the blood. This can cause deep, persistent itching called uremic pruritus. This itch does not feel like ordinary dry skin. It may feel deep under the skin, worse at night, and it often does not improve with moisturizer. The hands may also become extremely dry, cracked around the knuckles, or split at the fingertips. So ask yourself, does lotion help, or does the itching keep coming back? Does it feel like the itch is coming from inside the body? If yes, do not ignore it. Speak to your doctor. If the first signs sound familiar, swelling, color change, or deep itching, type hands in the comments. Not for engagement, but as a reminder to take your body seriously. Sign number 4. Weak grip strength or trembling hands. Have you noticed that opening jars, turning keys, or holding objects feels harder than before? Most people blame aging or arthritis. But weak grip can also be linked to kidney problems. Your kidneys help balance minerals such as potassium, calcium, and phosphorus. These minerals control muscle function. When they become imbalanced, muscles can weaken, cramp, or tire quickly. The hands are often one of the first places this weakness appears because they contain small, sensitive muscles. Anemia from kidney stress can also reduce oxygen delivery, making the hands feel weak or shaky. If your grip has become noticeably weaker over the last year, or your hands tremble when holding something still, do not dismiss it as just age. Sign number 5. Fingernail changes. White bands, brittle nails, or half and half nails. Now look at your fingernails. Healthy nails usually have a fairly even pink color, but kidney disease can create specific nail changes. One is white horizontal bands across the nail. Another is called half and half nails, where the lower part of the nail looks pale or white, while the upper part looks pink, red, or brownish. This pattern is strongly associated with chronic kidney disease. Brittle nails, peeling, cracking, or deep ridges can also appear when kidney problems disturb calcium and phosphorus balance. Your nails are not only cosmetic, they can reveal what is happening inside your body. If these changes are new, especially with other symptoms, get checked. Sign number 6, numbness, tingling, or burning in the hands. Have you ever woken up with pins and needles in your hands, even though you were not lying on them? Or felt burning in your palms or fingertips? This can be carpal tunnel, poor circulation, diabetes, or a pinched nerve. But kidney stress can also cause it. When kidneys fail to filter waste, toxins build up and can damage the peripheral nerves. This is called uremic neuropathy. It often begins in the hands and feet as tingling, numbness, or burning. If ignored, it can progress to pain and loss of sensation. I am not saying every tingling hand means kidney failure, but persistent, unexplained tingling, especially with swelling, itching, color changes, or nail changes, deserves a kidney function test. Ask your doctor about creatinine and GFR. These simple tests can show how well your kidneys are working. Sign number 7, unusual bruising or slow healing cuts on the hands. This sign is often dismissed as old age. Have you noticed bruises on your hands or forearms from small bumps you barely remember? Do small cuts take weeks to heal instead of days? With kidney dysfunction, platelets may not work properly. Platelets are the blood cells that help you clot and heal. When waste builds up in the blood, clotting can become weaker, so minor trauma can create larger bruises. At the same time, kidney-related anemia can slow healing. Yes, skin becomes thinner with age, but unexplained bruising, large dark marks, or slow healing cuts are not something to ignore, especially if they are new or getting worse. Your body may be asking for help. Please listen. Sign number 8, ammonia or metallic smell on the skin. This final sign surprises many people. Have you or someone close to you noticed a strange smell on your skin? Not normal body odor, but something chemical, metallic, or like ammonia. When kidneys are overwhelmed, waste products such as urea can rise in the blood. The body may try to remove some of that waste through sweat. When urea reaches the skin, it can create an ammonia-like smell. This is usually a more advanced warning sign, which means kidney stress may have been building for some time. If you notice this smell on your hands, arms, or body, and it does not go away with washing, please do not wait. Get tested. Now let us bring everything together. The 8 hand warning signs are persistent swelling or puffiness in the fingers, pale, yellowish, dull, or grayish skin, extreme dryness, cracking, or deep itching, weak grip strength or trembling hands, nail changes, including white bands, brittle nails, or half and half nails, numbness, tingling, or burning, unusual bruising or slow healing cuts, a persistent ammonia or metallic smell. Now do not panic. One sign alone does not mean kidney failure. Many of these symptoms can have other causes, but if you notice 2 or more signs, especially if they have developed over the last 6 to 12 months, make an appointment with your doctor. Ask for a kidney function panel. It usually includes creatinine and GFR. These are routine blood tests, and they can give important answers quickly. You can also start protecting your kidneys today. First, drink enough plain water unless your doctor has told you to limit fluids. Second, reduce sodium by cutting down packaged, salty, and processed foods. Third, move your body for at least 20 minutes a day. Walking, stretching, or light movement can improve blood pressure and circulation, both of which matter for kidney health. These habits are not a cure, but they can support your kidneys and slow damage when combined with early detection. Your hands have served you your entire life. They have worked, cared, built, held, and protected. Now they may be trying to tell you something. Pay attention to them. If this video helped you, share it with someone over 60. It may help them notice a warning sign early. And subscribe for more practical health information that your doctor may not always have time to explain. I am Dr. Michael Ellis. Take care of your kidneys. Take care of your life. I will see you in the next video.